Hello friends and welcome back to my channel. If you guys are new here, my name is Shreyas Vinayak and I'm a junior doctor currently working in NHS England. So since my previous video on my surgical on-call was well received, I thought why not make a follow-up video on my night shift on-call. Throughout this video, I'll discuss a couple of interesting cases that I came across as well as a couple of med calls that needed urgent attention. Well then, let's get started. So the surgical night shift in my hospital is from 8 p.m. to 8 a.m. We normally have either 3 or 4 nights in a row. If you guys would like to know how the on-call system works in my hospital, you can watch my previous video in which I go in detail on the different types of paging and pod systems that we use. So this current night shift is during the Easter break, so let's hope it's not too busy. I have a cup of coffee to keep me going for the next 12 hours, and please do let me know in the comments down below if you guys have any coffee recommendations, as I'm still trying to find the perfect beans. I'm currently living approximately 30 minutes away by car from the hospital, as I've recently moved closer to my girlfriend. I have finally been able to incorporate audiobooks during my commutes, and I'm currently listening to Your Money, Your Life by Vicki Robbins. After spending all my savings on Apple products and having a negative bank balance, I felt it's time I take my finances a bit more seriously. I get to the hospital around 7:50 p.m. and quickly change into my blue scrubs. Unfortunately, my hospital is introducing light green colored scrubs for the junior doctors soon, so I'm really not looking forward to that. We have our evening handover at 8 p.m. sharp, and the day team highlights patients that have been quite ill during the day, as well as the jobs to keep me busy during the night. So essentially, during a night shift, your main role is to attend to acutely unwell patients, as well as those that have been admitted overnight. I spend the majority of my night essentially reviewing unwell patients that need urgent medical attention, as well as med calls and crash calls. On some occasions, you might have up to almost 10 med calls with multiple admissions, while on others, you might even have some time to take a little cat nap. It's about 10 p.m. right now, and I've already had 1 med call so far. It was for an elderly gentleman that came in with appendicitis and just recently had an appendectomy. We also noted that the patient had quite an extensive history of cardiac issues, which deems him a high-risk patient. He just recently developed a fever as well as increased heart rate and low blood pressure. Based on our ABCDE approach, we noted that the patient most likely might be septic, and we commenced the sepsis 6 protocol. The mnemonic to easily remember what needs to be done is give 3 and take 3. What we give the patient is IV fluids, IV antibiotics, as well as some oxygen. And what we take from the patient is we take a set of blood cultures, we measure the patient's urine output, as well as we check the patient's lactate. We commence the patient on broad spectrum antibiotics while we wait for the blood culture report. Unfortunately, it takes a couple of days for the cultures to grow. However, if within these days the patient does not improve, the microbiologist will get back to us with the results as well as advice on the need to change the regimen plan. Fortunately, the patient did improve with some IV fluids and oxygen. He'll be someone I keep a close eye on and pop over now and again just to make sure he's alright. I've already informed this case to my registrar, and he's well aware of the patient, and we will need to proceed with further treatment or different management plan if the patient does not improve. As I mentioned in my previous video, in this hospital we use the pod system while we're on call. I just received a few tasks that I need to sort out, and I'll get back to you guys in a few hours. During your surgical on-calls, you will manage all the surgical wards, including the elective patients. In my hospital, we only have 5 wards to cover, but if you're on the medical rota, you have 6, including the COVID ward. I drop by each ward and complete any outstanding tasks, including popping a cannula in and reviewing a patient with some mild backache. Throughout the night, you get approximately 20 to 30 tasks in surgery. It looks like there's going to be some time to perhaps get some studying done today. Currently, I'm preparing for the MRCS Part A exam, so I try to get some studying done with every little time that I have. Let me know in the comments down below if you guys would like me to talk about my study plan and the resources that have been recommended by my surgical registrars. I try to get some questions in, and before I lose all hope due to how insanely difficult this paper is, we have another med call to attend to. I'll be right back. The med call was for another surgical patient that just recently had an elective procedure. The patient was a couple of days post-op, but all of a sudden developed increased heart rate with significantly reduced blood pressure. I also noted that over the last 12 hours, the patient had reduced urine output. On my examination, the first thing I noted was that the patient was slightly cold and clammy, with a capillary refill time of more than 3 seconds. This immediately alerted me that something might be going on. I proceeded with my examination and also realized that the patient's abdomen was quite distended. She was not in any pain or discomfort, but this was something that caught my attention. I quickly informed the nurses to try to get a set of bloods, as well as spoke to my registrar to come and review the patient as soon as possible. Upon reviewing the patient, even my registrar concluded that the patient might have some form of leak or collection within the abdomen, and the plan was to take her down to CT scan just to get an idea as to what's going on. Unfortunately, even with significant amount of fluids, the patient's blood pressure did not improve. We reviewed the bloods taken during the med call and noted that the hemoglobin had dropped quite significantly within the last couple of hours. After a couple of minutes, we realized that the patient would not be stable enough to be sent down for a CT scan, and the patient would most likely require urgent theatre. We spoke to the consultant on call and got the patient prepped for the OR. Hopefully we managed to catch it in time, and I'll let you guys know how that goes. So back to trying to get some studying done. Unfortunately, the coffee in my system is slowly wearing out, and I think it's time for a break. According to our contract, we are supposed to take breaks every 5 hours since starting the shift. Fortunately, tonight though hasn't been too bad. There have been times, especially during the peak of COVID, when we go the entire shift without a break or even a sip of water. Sounds like hell, but to be honest, I've had more good days than bad in this job, and if you enjoy what you're doing, every day is a joy. I have a few biscuits that I sold from the storeroom and watch a few videos on YouTube. On our surgical night shift, it's also our responsibility to clock in all the new admissions as well as start them on appropriate treatment. Thankfully, since starting my shift, I've only had 2 patients come in due to pancreatitis. It's really important to note that when managing pancreatitis, you need to keep a close eye on their urine output as well as fluid resuscitate the patient. Unfortunately, there's no form of treatment for pancreatitis, as mainly we provide supportive treatment in terms of fluids as well as medication to manage the pain and nausea. The 2 common causes for pancreatitis is gallstones and alcohol, and it's a bit of a funny one, as I've seen 8-year-olds who've come in due to pancreatitis feeling absolutely fine within the first few days and getting discharged, while I've seen 30-year-olds who've needed ITU support and further treatment. Well, it's about 4 a.m. right now and there's nothing much going on, so I'm just going to try to get a little cat nap before anything exciting happens. So I've just been tasked to review a patient who's complaining of a bit of chest pain. He's quite a young gentleman who came in a couple of days ago for an elective procedure. He doesn't have any significant past medical history of any cardiac issues, so I'm not too concerned, but let's go see what's going on. So when taking a history from a patient with some chest pain, it's really important to rule out the more sinister causes such as a heart attack or a pulmonary embolism. I proceeded with getting more information on the pain itself as well as to assess if there are any other associated symptoms. I carry on to do a full physical examination, including listen to the heart, the lungs, as well as ensure the observations are normal. After completing my review, I was quite confident that the pain was musculoskeletal in nature, but further investigation is indicated, especially in a patient with a recent history of surgery and reduced mobility. I reviewed the patient and he only seems to have a slight chest pain on the left side and a bit of nausea. Again, it's something that we would try to keep a close eye on, so I've requested the nurses to do an ECG as well as send down some bloods for troponins. But because he has no risk factors and the pain is not characteristic of a heart attack, I'm not too concerned. I come back to the office and start working on some projects that are due soon. Normally after finishing night shift, I feel absolutely unproductive and groggy. I know I'm not going to get much work done over the next couple of days, so I try my best to get work done while I'm in the hospital. Before you know it, it's already time for the morning handover. I let my team know I had an amazing night with nothing outstanding to hand over. My registrar will hand over the new patients to the on-call consultant and clarify if further intervention is needed. That concludes my night shift on surgery. I hope you guys enjoyed this video, and if you did, hit the like and subscribe button down below. And even if you didn't, hit those buttons and add a comment down below as to how I can improve on my videos. Now that you have a glimpse of what a junior doctor does during their night shift, add any questions to the comment down below and I'll try to answer them the best I can. You can follow me on Instagram and Twitter with the links down below as well. Catch my previous video on my surgical on-call as well as how to make money in uni as a medical student. Wear your mask and stay safe out there, and I'll catch you all in my next video.